My guest today is one of the country's most successful experts on TRT, Dr. Larry Lipshultz. Welcome to the show. There seems to be a lot of misconceptions.
You know, I'm glad you asked that. I don't like TRT. I don't like the name. We're not really replacing their testosterone.
You know, for the longest time, there seemed to be like a stigma. I've had some guys say to me, isn't TRT, testosterone replacement therapy, just for guys who have erectile dysfunction?
Welcome to the Labrada Show.
Welcome back, everybody. And my guest today is one of the country's most successful experts on TRT, otherwise known as testosterone replacement therapy. He's an authority in using testosterone to help males improve muscle tone and strength and enjoy more energy and improved health. Dr. Larry Lipshultz is professor of urology and chief of the Scott Department of Urology at Baylor College of Medicine right here in Houston. Recognized as a leading expert on men's health, Dr. Lipshultz is a highly respected author, lecturer, editor, and teacher. Dr. Lipshultz instituted a fellowship training program in male reproductive health and surgery that has trained more than 110 physicians who are now in practice. Dr. Lipshultz holds the Smith Chair in Reproductive Medicine and received his medical training at the University of Pennsylvania and received fellowship training at the University of Texas at Houston as the first American Urological Association research scholar. So today we hope to give you guys all of the answers on TRT, testosterone replacement therapy, from one of the country's leading experts on the subject, Dr. Larry Lipshultz. Welcome to the show.
Thanks, Lee. Good to be here.
Well, Dr. Lipshultz, would you start by just telling us your story? What attracted you to become a urologist?
So like many other areas in medicine, I had a role model. And, you know, very often in medicine, you go into your specialty, your subspecialty, because you identify with somebody who you want to be like. So that happened to me. I worked at Penn in the summer while I was in college and got assigned to a doctor with whom I was supposed to do research, and he just turned out to be a urologist. So I didn't even know what it was, but I decided I wanted to be like him. So when I started medical school, I continued to do research with him, and then as we got into clinical rotations, I did find out that I liked urology. I liked a surgical subspecialty, so I ended up staying in urology, and the rest is history.
And you have a huge practice here in Houston, and people look at you not only as the go-to doctor for TRT here in Houston, but they can fly in from all parts of the world. So what is the definition of testosterone replacement therapy?
You know, I'm glad you asked that, because I was thinking, I don't like TRT. I don't like the name.
It's an acronym. So for one thing, it's kind of hard to remember, but it's become the thing. People refer to it to that.
The history of it is initially there was HRT, hormone replacement therapy for women.
Right.
Because women don't make any more estrogen after a certain point in their life.
That's right.
But men never stop making testosterone. So we're not really replacing their testosterone. We're performing testosterone therapy. We're offering testosterone therapy.
So what's the difference between replacing their testosterone and testosterone?
Because we're adding to their body's production of testosterone.
Right.
We're not replacing a hormone that's no longer being produced, because men always will produce some.
That's right.
Even as they age. So it's really, I like calling it testosterone therapy rather than TRT, which is just a misnomer held over from the HRT in women.
That's very interesting. You know that there seems to be a lot of misconceptions about testosterone replacement therapy over the years. And, you know, for the longest time, there seemed to be like a stigma. You know, guys would be hush-hush about being on testosterone replacement therapy. In fact, I've had some guys say to me, isn't TRT, testosterone replacement therapy, just for guys who have erectile dysfunction? Yeah. You know, and nothing could be farther from the truth. So,
exactly.
You know, who is a candidate for testosterone replacement therapy?
Right. So as of now, based on FDA guidelines and the American Urological Association guidelines, you should not be offering testosterone therapy to men unless they have low testosterone.
And what is low testosterone?
Exactly. That's the misconception. I mean, the FDA has set it at less than 300 nanograms per deciliter, but it changes as you age. So when you're 18, 22, 30. Should you have a testosterone of 320? No, it's probably more accurate to be 500, 600, 700. So when you see people, I think you have to make somewhat of a judgment call as to whether that individual is deficient. But if you want insurance coverage for testosterone, you have to present values to the insurance company of less than 300.
So it's not just for older guys. You actually see some younger guys that have lower testosterone.
Yes. I mean, I saw somebody the other day, and he came in with a testosterone of 90.
Yeah,
I mean, that's terrible.
That's very low. And this guy was, what, in his 20s, 30s?
Yeah, mid-20s.
Yeah, that's really low. Why has the medical community been so slow to accept testosterone replacement therapy? Why do a lot of doctors just not want to deal with it?
I think because there's been so much bad research on problems with testosterone. A couple of years ago, maybe 8 years ago, 10 years ago, there were 4 articles published at about the same time from very reputable medical journals, including the New England Journal, saying that testosterone is associated with increased cardiovascular events in elderly men. When you go back and dissect out the data, it was terrible data. And many people wrote articles refuting the data and saying that was very poorly constructed. There was poor conclusions, and yet it got a lot of press. So a lot of times what we're doing is publishing data to show that other data is inaccurate and misunderstood.
There seems to be, some controversy as to whether testosterone replacement therapy, has any kind of negative effect on your cardiovascular system, on your heart, and that type of thing. What's your position on that?
My position is that it doesn't. I think what happens, though, if a person is taking testosterone and he's also a poorly controlled diabetic and he develops cardiovascular disease, why blame the testosterone when he would have probably ended up the same place because of his diabetes? In other words, you have to look at the other comorbidities that the individual has.
Pre-existing conditions?
Yeah, that may have been one of the reasons why he's taking testosterone, but it's not the testosterone therapy.
So a older man with low testosterone who starts taking testosterone as part of therapy should not expect for his, cardiovascular factors to worsen.
No, as a matter of fact, we did a study once where we worked with a very large national database. So this was a company that was offering what they called single molecule determinations of cardiovascular disease. But it was, whether it was single molecule or not, it was a very sensitive way to look at markers of cardiovascular disease. And they had about 10 different markers. And we got a hold of their database. We worked with them. We said, let's take a look at your database. There's thousands and thousands of patients. But we also had the testosterone, the patient's testosterones. So when you looked at the testosterone on one axis of a graph and you looked at the cardiovascular markers, the men who had the highest testosterone had the lowest incidence of cardiovascular abnormal markers.
That's amazing.
Yeah. And it was very marked. And we've published this.
That's very amazing. You do quite a bit of publishing of studies. You run studies yourself.
Well, we do, because I have 2 fellows every year. We have a resident. We have medical students. And part of learning about a particular subspecialty is trying to do innovative research. So they all get involved.
So we talked about heart disease and testosterone. What about cancer? Can it create cancer in the prostate? Can it create testicular cancer or other types of cancer?
Well, testicular cancer is not a hormone-dependent cancer. In terms of prostate cancer is a hormone-dependent tumor.
Okay.
It is androgen-dependent, up to a point. So what's been shown through what's called a saturation model is that the prostate can only respond to a certain amount of testosterone, and it's about 180 nanograms per deciliter. Beyond that, the prostate doesn't respond. It doesn't grow. It doesn't produce cancer. So it becomes saturated at a fairly low level of testosterone.
So increasing the amount above that low level, which you said was 180.
Is not going to give you cancer.
It's not going to give you cancer. Because that's one of the things guys worry about. Another one that they worry about, is it going to make me lose my hair?
Yes. Well, what makes you lose your hair is dihydrotestosterone. And testosterone, to some degree, is converted to dihydrotestosterone. So there is some relationship between excess testosterone and hair loss. But there are very good blockers of dihydrotestosterone, such as finasteride, which you can take, and that will, to some degree, block your loss of hair due to testosterone.
Do you typically put your patients who are on testosterone replacement therapy on finasteride as well?
I don't do it prophylactically.
Okay.
I will do it if they start to complain that they think they're losing a little bit more hair.
Okay, in case it accelerates.
Because not everybody is going to have hair loss.
What are some of the positive things that a patient can expect from testosterone replacement therapy?
Well, I mean, I think you have to look at what his situation is when he starts taking it. If he has low energy, fatigue, related to his low testosterone, that will get better. If he's got obesity, if he can't put on muscle mass because he keeps putting on fat, and if he has low testosterone, that process will get reversed. You will have an easier time putting on muscle mass. If you're depressed and it's related to your low testosterone, that should get better. So you have to look at the negative aspects that the patient's bringing to you, and those, if they are testosterone dependent, will of course necessarily get better.
You mentioned estrogen,
Yeah.
and so something that I read was that men who are morbidly obese or significantly overweight and carry larger amounts of body fat tend to have higher estrogen. What is the perspective on that?
Well, it's true because testosterone is converted to estrogen in fatty tissue by aromatase. So you can offer aromatase inhibitors, or you can help them lose weight. I mean, so a lot of our patients come in and we have to work with them on losing weight. So it's good to have a nutritionist in your corner, a dietitian in your corner. It's good to be able to send people for, optimization of their diet to somebody, because we certainly don't have time or the expertise to do that, but we can help them work with their hormones.
So is your suggestion to men that are getting older, or men who are having difficulty changing their body composition through nutrition and exercise, to get their testosterone checked?
Yeah, especially if they are having a difficulty despite the fact that they're doing everything they should with their diet and with their exercise regimen. Because something is wrong if they're not making advances. And not uncommonly, it is their testosterone.
A significant amount of the patients who use testosterone replacement therapy, I'm assuming, are older patients. And so one of the things that, once you pass your 50s, you start thinking about, obviously, is lifespan. And from an anti-aging perspective, does testosterone replacement therapy slow down the deterioration that could lead to disease states, chronic diseases, and things like that?
I think it does. But, again, if you present to the physician with low testosterone, then optimizing it is certainly going to have a beneficial effect. Now, if you come in and your testosterone is not terribly low, then that becomes the current dilemma. What do you do with those people? I mean, if they have the characteristic symptoms of low testosterone, but their testosterone is not classically low, do you still offer them testosterone to create a better, hormonal milieu for these things to get better, for these symptoms to get better? And that's very controversial right now.
Right.
Because we are stuck with the FDA's definition, 300 or less. Again, but that's in all people, and it's unfair because when you're 20, your optimal testosterone level is not going to be the same as when you're 60.
Right.
But there is no data, so we don't know what we should be. We don't have a target.
How do we change that? How do we get the data?
Well, we do research. We look at age-specific testosterone in people who are healthy versus people who are not healthy, and you publish the data. It's just a very hard study to do because you need thousands of patients.
So I know that men that come to you that have low testosterone, they might be suffering from impaired testicular function already. But for those with healthy testicles, can TRT cause testicular shrinkage?
Yes. So what I present to patients when they come in is, look, your testosterone's low. We're going to start you on testosterone. Are you concerned about the fact that your testicles are going to get smaller? Because, once they stop producing testosterone, because we're giving you excess testosterone from the outside, they will get smaller. Some men say, I don't care. Other men say, yeah, I don't want that to happen. So we give them something called HCG, human chorionic gonadotropin. They do a shot, an injection subcutaneously once a week, and we can prevent loss of testicular size. And we could also optimize testicular function so that when it comes time to reverse the process and have a baby, because their sperm production is going to be turned off to some degree by that testosterone, we can turn it back on.
How do you do that? How do you turn it back on?
We give them high doses of HCG and high doses of something called FSH.
Okay.
And they can mix them together, give themselves injections 3 times a week, and we can literally get them back to where they were.
And so this is something that they self-administer
Yes.
under your supervision.
Right. The other thing we're looking at now, though, is can these individuals also take low-dose testosterone at the same time so they don't suffer from having the recurrence of the symptoms that made them take testosterone to begin with. And I don't know the answer to that yet. It looks very encouraging that once we get sperm production going with HCG and FSH, we can introduce testosterone to some degree, but I don't have the data yet, 100%.
And this one is for some of the younger guys that go on testosterone replacement
Right.
therapy. This question would be for them, can it impair their fertility in the long run? You know, in other words, a lot of them want to know, you know, if I go on testosterone replacement therapy, but I want to have kids in the future, you know, what are my odds? What are my chances?
Yeah, that's a really good question. It should not be a problem because we should be able to get them back to baseline in terms of their sperm production.
Right.
And we do it every day of the week. We see these people. We work with the gynecologists who are treating the wives, and we get the husbands back to where they should be. The problem is that when young guys start taking testosterone, they don't know what their sperm production is.
Right.
And, you know, there's going to be a certain percentage of men who, when they walk in the door, are going to have very poor sperm production, just statistically. Anyhow,
Right.
unrelated to anything that we can maybe clearly identify. So when those men decide they want to have a child and we're giving them this rebound protocol of HCG and FSH, we may not be able to get them back to wonderful numbers because they didn't come in with them.
So it's a good thing for them to get a baseline measurement.
I try to encourage them. Let's get a semen analysis. We'll have the record.
Get a count.
Yeah, just have it done.
And have it on record.
Yeah, it's painless.
Is testosterone replacement therapy, is that the use of anabolic steroids? Does it fall under that?
Yes.
Or is that something different?
No, all testosterone is anabolic. So this thing that, he's taking anabolic steroids and the other man is not, he's taking testosterone cypionate, they're all anabolic steroids. I mean, they're just different degrees of anabolism or anabolic potency versus their androgenic potency.
And it seems to fall into a gray area, in terms of, the way that society looks at this, and I've often wondered, if, they'd look at men differently than women. It seems that when men reach a certain age, their testosterone starts falling off. I mean, would you call that andropause?
No, I don't like that word either. The reason why it comes from menopause. It's derived from, women stop making estrogen.
Right.
I mean, it goes to zero.
Right.
So they need estrogen in order to kind of reestablish some normal body functions. Whereas men, testosterone doesn't go to zero. So to call it andropause is really a little bit of a misnomer. They just have, testosterone deficiency as they age.
Okay. We're going to come back to testosterone replacement therapy, but allow me to go in this direction for just a second, because there are going to be people in our audience that are using supra-physiological doses of testosterone and anabolic steroids, for bodybuilding purposes, for athletic purposes, and that type of thing. What are some of the precautions, that athletes need to take when they're on larger dosages of these compounds?
I would certainly encourage them to try to be under a physician's care. I mean, anybody that we see who is taking high doses of anabolic steroids, we keep a close look on their blood thickness, which is the hematocrit, on their lipid profile, their cholesterol and HDL, LDL. We watch their estrogen. And, we treat it when it gets out of line. And I think if you're treating things that are abnormal, while they're taking high levels of anabolic steroids, then you theoretically are not going to get into trouble.
Does testosterone worsen the profile of cholesterol in your body? In other words, does it drive down the HDLs in the same manner that other anabolic steroids
Yes.
would?
Not as bad.
Okay.
If you're just taking the common things we see are testosterone cypionate, enanthate, and propionate. And these are the esters attached to the testosterone molecules. So these do not have the bad a profile as some of the more tailored steroids that have been produced to help with just muscle growth. They seem to have more of a negative effect on lipids.
And what kind of negative effect do they have?
They drive down the HDL.
Which is the good cholesterol,
Yeah.
right?
That's primarily what they do.
Okay.
Because most of these men are very careful about their diets, extremely careful about their diets. So they tend to have pretty good cholesterol levels, but their HDL goes down. So your HDL should be above 50, all right? And it's not unusual for me to see athletes with single-digit HDLs.
Which is dangerous.
Which is dangerous, yeah.
Because of atherosclerosis and
Right.
clogging of the arteries.
Right.
Do you see a lot of cardiovascular risk with some of these athletes, bodybuilders and athletes that use anabolic steroids?
So, and that's a great question. So I have a cardiologist with whom I work who's very non-judgmental. And that's what you need. You don't want a cardiologist who every time you send somebody in who's a bodybuilder or an athlete, he gives them a big story about you're doing something that's going to hurt you. You just want them to evaluate their cardiovascular system. So I do fairly regularly send these guys to the cardiologist for just a baseline, even if they're not symptomatic. We want them to do an echocardiogram, get an idea what their cardiac function is. And I will tell you, it is very rare, if not never, do I see these younger guys with cardiovascular problems.
Now I'm gonna stop you there for a second because there's this perception right now in the bodybuilding community, athlete community, that some of these athletes are dying off, in their 40s and 50s sometimes because of abuse of anabolic steroids. What's your position on that? What's your take on that?
My position is, what else are they doing?
Right.
I mean, these people are not just taking anabolic steroids. They're taking growth hormone in very high amounts. They're often taking insulin. They're fooling around with thyroid hormones. I mean, really, I've seen them come in with outrageous levels of thyroid hormones that somebody has told them to take. So it's not isolated testosterone and its derivatives. It's the big change in weight.
It's all of the things that come with it.
Yeah, it's the going up 30 pounds and going down 30 pounds.
And Larry,
that's not good for you.
Dr. Lipshultz, there's also something that can't be overlooked, is that anabolic steroids or not, there are people that have genetically are predisposed to certain conditions in their 40s and 50s. You hear of people in their 40s and 50s that have heart attacks, or die suddenly, and they've never touched an anabolic steroid in their life.
Exactly.
So that's just one of those things that are out there, and that I wanted just to.
And again, I would say, for these individuals, they can find somebody wherever they live who is interested in taking care of them.
So you're saying that there are doctors pretty much in any large population center
Right.
that would help them if they wanted to take testosterone replacement therapy.
Right. And make sure they're staying healthy. Now, they're not going to be prescribing super physiologic levels. I mean, but they will be, sensitive to the fact that this is what these people are doing. And as a physician, our job is to make sure they're staying healthy.
Okay. And obviously, diet plays an important part in that.
Huge part. But for the most part, these individuals have really good diets. I mean, they're very careful about their high protein, low carbs, plenty of fluids.
Any advice for men who are thinking about testosterone replacement therapy, and want to take that first step or want to explore how whether it's right for them, let's say?
Right. Well, again, it's baby steps. It's, if you're going to a doctor and he's going to offer testosterone for some type of complaint and they have a low testosterone, don't jump in with very high levels of testosterone therapy. I mean, go start low because you may get a lot of benefit out of very low levels.
So a lot of times guys will go to their general practitioner first,
Yeah.
not a urologist
Right.
and not a urologist with a specialty like
Right.
you have. And the MD, the general practitioner, will say, no, don't mess around with the testosterone. It's bad for you.
Exactly.
And that'll be the end of the story. Well, my doctor said that it's not good for me. Well,
Right.
what would you say to that?
Well, I mean, if you're low, then that's bad for you.
So at least get the doctor to test you
Right.
to see if you're low.
Exactly. And if it's low and he won't treat you, then find a doctor who's willing to treat you. I'm very concerned though about all these low T centers that are springing up.
Those are popping up everywhere.
Yes, they're not owned by physicians usually. They're owned by businessmen,
Right.
And they're not run by physicians. They're run by mid-levels, nurse practitioners, and physician assistants.
Okay.
And you have to be really careful.
So you would not advise them to go to one of those so-called centers.
No.
They should find a specialist.
Right, but I don't want to globally say they're all bad.
Sure.
Because I'm sure there's very good centers.
It's like anything else.
Yeah, but you have to be cautious and understand who's treating you and what their expertise and what they're offering.
Do you find that men who undergo testosterone replacement therapy experience any profound psychological changes?
Sometimes, but it's positive. It's not negative. I mean, I've had many patients say, "This therapy is life changing," and I think the word life changing is what they usually say. Having not spoken to each other, they say it's just life changing. I'm a different person.
Does testosterone have psychoactive components? In other words, does it improve depression or anxiety or any of those things?
Well, I think it does. Now, is it direct or indirect? In other words, if your self-image gets better, then are you going to feel better? Well, you are. You're going to feel better about yourself. And if you had borderline depression or whatever, it's going to be better.
Sure.
Whether or not, if I gave anybody testosterone, they're going to say, wow, I feel better. I don't think so.
So there's no direct correlation in terms of physiological components to having a better, more positive mental outlook, for instance.
I don't think so, but I don't want to say no.
Okay.
Because, I mean, we know that it does. If you give too much testosterone to somebody and they do have a tendency to be aggressive, they may be more aggressive.
Then it exacerbates.
Yes.
That.
So if you have certain underlying personality abnormalities or defects or tendencies, you could exacerbate it or make it worse with testosterone. Or you may treat it if it's something that's going to respond because you have low testosterone. So again, it's very individualized.
If a man wants to start testosterone replacement therapy, who should he get in touch with?
I would say first your family doctor, because they're not all negative on testosterone, and at least get tested. If it's surprisingly low, then you've got to find somebody in your community who knows what they're doing to treat you.
What if someone wants to come and visit you, Dr. Lipshultz? How do they make an appointment with you?
They just call the number at Baylor and make an appointment. But don't forget, as you said in the beginning, we've trained over 100 fellows.
Okay.
So in every major city, basically, there's one of my fellows they'll be willing to treat.
All trained by you.
Yeah, and they would be willing to treat. So
I would say that testosterone replacement therapy is something that's generally good for men to look into, especially as they get older, and or men who are younger but they're having difficulty. They've done everything they can dietarily and through their exercise program, still not seeing a change in body composition.
right, or if they're fatigued and they can't figure out why. One thing we're finding out is the presence of obstructive sleep apnea in a lot of these younger guys.
Does that affect testosterone?
No, but it affects your fatigue.
Right.
So in other words, if they come in and they're fatigued and we optimize their testosterone and they're not feeling better, then I work with a sleep center to get these people evaluated. And it's really surprising how often you're going to have a diagnosis of sleep apnea.
Yeah, the sleep apnea is becoming very prevalent.
It is.
But I know that these sleep apnea machines are just incredible for that kind of thing.
Yeah, it really makes a big change.
What are some other things that men have to be careful about that might lower their testosterone? I mean, in terms of environmental or dietary factors.
Well, obesity, we talked about that.
Right.
I think poor sleep. I think somebody who doesn't sleep is going to have problems with their hormone profile in general, because during sleep you do kind of optimize some of your hormone production. Exercise. I mean, we know that if someone exercises and decreases their body fat, their testosterone, their native testosterone will go up.
So any kind of exercise or weight training, for instance?
Weight training and aerobic exercise.
Okay, this is great stuff. Dr. Lipshultz, I want to thank you for joining us today. This has just been incredible. It's been very, very instructional. Very informative for me, and I'm sure very informative for the guys that are going to be watching this. Because it really has helped to lift some of the mystique off of testosterone replacement therapy and some of the more commonly asked questions.
Yeah, well, thank you. I hope it helped.
I absolutely did. And help us to grow the Labrada Show by hitting the share button right now, the subscribe all button, and be sure to share with a friend so that you'll get the podcast as they become available. And you guys stay motivated, get up, look up, and God bless. We'll see you next time.
The Labrada Show.
Thunder from a distant shore, voices in my head imprison me.